to a better way, a sustainable approach to dentistry. Tonight we have a really special show. I am Dr. Reed Winnick.
I am Tammy Kolschmidt.
And tonight we're going to discuss digital infrared thermal imaging. This is a technique that picks up inflammation in the body. We use it in our dental office for patients to look at their head and neck, because many times there is subclinical inflammation that they don't even know or feel. But we also use it as full body scans for men and women, for women's health screenings or men's health screenings. It's also used and very popular for women who want to have images of their breasts because they're not comfortable taking mammograms. Tammy is a certified clinical thermographer, and she's going to give us a great show tonight.
Thanks, Dr. Winnick. So I became really excited about learning thermography because my mom had breast cancer.
When did she have breast cancer?
This was years ago, and the important thing about this is that she found the lump in her breast, and she had been having mammograms for a good 10 years prior.
Wait, so the mammograms didn't pick up the lump? She found it?
Right, the mammograms did not pick up the lump because mammography cannot pick up tumors until they're the size of a dime, which is 8 to 10 years growing. Mm-hmm. So she found the lump on her own. She went and had another mammogram.
And then they found it.
Well,
that's good.
Right. And they said to her, you've probably had this tumor growing for the past 10 years.
But she found it with a self-exam.
A self-breast exam, she found it.
Okay, so issue number one for tonight's show, make sure you learn how to do a good breast self-exam.
Yes.
That could save your life right away. And I believe later on we'll give them information on how to do that in a book we have.
Right.
Okay.
Yeah.
Okay, good.
So she went through the whole gamut of chemo, radiation, mastectomy, and that's the point of tonight's show, is that thermography is a better way because it will detect a tumor when it's only 256 cells, which is the size of a grain of rice. And at that point, the cells are easy to reverse. Without radiation, without chemo, you can do it with lifestyle changes.
So it's zero radiation. Also, there's no of that squishing feeling I hear about?
Yeah, with thermography, there's zero radiation, there's no body compression, and there's no squishing. There's no body contact whatsoever.
That sounds great.
So it's done in a cool room, and it's a better way.
Excellent.
Okay.
So you want to show us some of the slides that you brought with you?
Sure. We'll be discussing, I'll show you some slideshows, and as we go, I'll discuss what it is you need to look for. Number one, you need to know that thermography measures body temperature and heat patterns.
So you're comparing the right to the left side?
Yes.
Okay.
You're comparing your body against your body, the right side to the left side, with heat and pattern temperatures, and also cold. Mm-hmm. Okay? So this first picture is showing a normal breast study, and already you can see that you get many views of the breast, unlike a mammogram, right? This shows you the lateral side of the breast, the armpits, a frontal view, and interproximal, so you can see between the breasts.
So if you just compare this to the mammogram, which is you're not getting as many views, and you're not getting between the breasts or under the breasts.
Yeah.
Is that true?
And you're not getting as much information because thermography measures body physiology. It measures your cells and your tissues. So you can see if there's stagnation of lymph. You can see if your hormones are out of balance. You can see if a tumor is forming. You can see if you have digestive stagnation.
So it's like a thermal thumbprint.
Yes, it's a picture of what's going on in your body, the physiology.
Okay, great.
So if you look at this slide, you see the white arrow pointing to that little green dot with a black circle around it. That green dot is a tumor. It's 256 cells, which is when a thermogram can pick up beginning cancer. And you can see the red coloring that's going around that green dot. That's neovascularity. That's new blood formation. And the tumor is drawing sugar from that blood to feed it. And that's early stage breast cancer.
You know, this is reminds me that one of the reasons why we brought this tool into our office is what happens is if a patient has inflammation in the mouth, which is an indicator of high temperatures and an infection, well, that infection causes the liver not to function the way it
Right.
normally should. So if the liver is busy taking care of the infection, it can't deal with its other job, which is to modulate hormones.
Right.
And if the hormones aren't functioning properly, then you get problems with the breast.
Exactly.
So that's the tie-in between healthy breasts and a healthy mouth.
Or a healthy body, because you could have a tumor elsewhere in the body, and the liver will still be working on the infection in the mouth, and the toxins aren't leaving as quickly.
Right, well that's true, but I'm a sustainable dentist. And
Right.
if I can find a way to keep my patients healthy and know that the mouth, once again, is tied into overall health, this is a great example of that.
Absolutely. This is another breast picture, and you can see the breast on the left, on our left, is very white hot and red. That type of breast cancer is called IBC, or
What does that stand for?
inflammatory breast cancer. And it starts at the nipple and it shoots out.
And
It's
that's
like
due
fire.
to a virus?
It's due to a virus. Mammograms don't always pick this up until very late stages,
Right.
because it's viral. So there's not necessarily a tumor.
And I once heard a story of a woman whose daughter died from this.
Well, this, for whatever reason, is affecting our young women
Uh-huh.
in the 19 to 20 range.
Right.
So,
Wow. So
this
is that something they can pick up also with a breast exam? With a self-breast exam?
Not necessarily, because you may not feel anything.
Right. So you have a inflammatory condition that's not picked up by a mammogram, and you can see it on a thermogram, and it's another way of having an early warning sign of possible problems.
Right.
Wow.
And thermography was approved by the FDA in 1982. And one of the reasons it's not being used in place of mammography right now is because mammograms are billions of dollars in the business world.
Mm-hmm.
And also it is a set standard of care. So a shift is starting to happen. More doctors are learning about thermograms, and the more that they learn about thermograms, the more they'll understand the benefits.
Right, because you can pick up a problem if someone has like carpal tunnel syndrome. You can do an image of the hand, and you can see the pathway of the inflammation, and it may not be what they think it is. It could be just a sprained arm or something.
It's used to detect all types of diseases in the body. This is an interesting picture. These are normal thermal patterns. The breast picture on the right, you see the cold blue breasts. That woman has implants. So thermograms are great for women with implants because there's no compression and no squishing. And the body's temperature will still show through, because our temperature patterns do not lie. They are telling the story.
Why is it so white and red underneath those breasts?
Good question. That is heat, and that's usually coming from a bra, an underwire bra, to be more specific.
You mean a metal
Right.
piece of...
Underwire bras cut off circulation. They cut off blood flow, they cut off lymphatic flow, and they cut off our energetic meridians.
So what would someone do with this kind of situation?
Well, it's best to not wear an underwire bra. You can get bras that are foam and supportive without the wire.
And you know where to get these bras?
Yes.
Okay.
And ladies, if you can wear the less you wear your bra, the better off you are. And the best thing I could say is, whatever you do, don't sleep in your bra.
I've never heard of people sleeping with their bra.
All women sleep in their bras. A lot of women do this. I don't know why. But
I know some women who sleep with their dentures in, but not the bra.
just as bad. So you see these spotty colors in the breasts here on the left. That's fibrocystic breast, right? So those aren't tumors, but those are cysts.
Right.
And
Also not a sign of health.
well, not a sign of health, and it can be reduced with diet changes.
Mm-hmm.
Okay, so this picture is of a man with breast cancer, and you can see the arrow pointing to the tumor. It's the tumor is yellow, which means it's cool.
Wait,
And
you
then
said a man has breast cancer?
Yes, 1% of men do get breast cancer.
Oh, who knew that?
And the redness around that yellow is the blood flow that's supporting that growth of that tumor. And if you look higher up in the picture at his mouth, you can see the white hot spots. Those are indicator of either a gum infection or a tooth infection.
Like a root canal?
Could be. So he would have to have a dentist or a hygienist look into his mouth and find out what's going on there.
Right. And he probably doesn't even know that he's got a problem.
He probably does not even know, because you don't feel these things. This is a great shot of the digestion. One thing to know about breast cancer and digestion is that if your digestion is not functioning properly, it will reroute stagnated fluids up into the chest cavity and cause acidic tissues. So when we are looking at breast cancer, there's 3 major things we're looking at, which is lymphatic drainage, because our lymphs carry toxins and waste. So we want to keep that lymph moving. Number 2 is hormonal imbalance. So you need to get your hormones in balance to make sure that you're not getting estrogen dominant or low progesterone. It's another way of saying it. And the third thing, again, is the digestion. We've got to keep things moving.
Right, but I think an important point here is that we keep saying the word cancer. A mammogram, a thermogram, none of these technologies that are radiating or not radiating, because a thermogram measures heat, we're not diagnosing cancer. You can't diagnose cancer from a picture. The way you do it is after you get any kind of positive results, we would send you to a specialist who has other instruments and then can take you to the next level. But the beauty of the tomography, which Tammy was bringing up, is that when you have a shot like this, it's not just the breast. You can see half the body, and if there's stagnation, you can see how it builds up, and that can be causing a problem before a mammogram would even know it exists. And that's the key, because you're getting a global look of the whole body and the whole environment of the body.
And the other thing with this picture is you can see on the left side of the screen, on the left side of her belly, that white hot spot with the red around it. That's inflammation of her large intestine. And she may or may not know that that's there. You don't always have symptoms when you're inflamed.
So she could be maybe constipated or something.
There could be a blockage. There could be rise in bacteria. There could be fluids that are not moving.
Right. All we know is that there's inflammation, and you might want to look at that with your caregiver.
Exactly.